VirtaMed ArthroS Realistic Arthroscopic Learning. COP VirtaMed ArthroS, students can be ready for the working room rapidly and productively. It can uphold students through their arthroscopic venture with progressively capability-based and society-supported educational plan, and more mind-boggling preparing cases. VirtaMed ArthroS simulators, the knee, shoulder, hip, ankle, and fast modules. Offers the most sensible preparing climate conceivable, with normal haptic input and photorealistic designs. Approved to accelerate the learning interaction and subsequently work on the presentation of understudies. Various anatomic modules, shoulder, hip, lower leg and knee, on a solitary stage. Lessons preparing time and cost, with capability-based preparing and evaluation. Different clinical preparing establishments have discovered that joining recreation with their educational program improves preparing results as well as supports better persistent consideration. Speed up preparing. Test systems give hazard-free active preparing that permits understudies to make mistakes and test limits. Educating with profoundly reasonable designs and unique instruments can facilitate the exchange of abilities from the test system to the working room. Bit-by-bit guidelines assist learners with fostering their fundamental arthroscopy abilities before they are directed through progressively convoluted demonstrative and remedial cases. Move achievement. Learners can be questioned with inside and out input reports that rapidly distinguish regions for development. Unbiasedly assesses the learner's abilities to set targets and benchmarks and guarantee that they secure foreordained degrees of capability prior to going into the working room. VirtaMed's general public-supported course assists understudies with arriving at benchmarks, or collaborate with VirtaMed to make the top-tier course of their own. Set aside time and cash. Inhabitants at first prepared on a test system set aside less effort to complete the methods once they are in the working room and in this way make less blunders. Students go into the working room in the wake of dominating the fundamentals, and would thus be able to zero in on acquiring extra complex abilities. Learners, who have ordinary admittance to a test system, can arrive at characterized capability levels speedier, which implies they get into the working room sooner. The capacity of the test system to show an enormous number of various pathologies, to recognize them and to archive them recognizes the VirtaMed ArthroS from preparing on traditional models, yet additionally from preparing in the working room or on dead bodies where this high number of changeability is absent. This is truly what makes the VirtaMed ArthroS an interesting preparing apparatus. Dr. Robert T. Burks, MD, Department of Orthopedic Surgery, University of Utah, USA. Modules. Essentials of Arthroscopy Surgery Training, FAST. VirtaMed has planned the Fundamental of Arthroscopy Surgery Training, FAST, module in relationship with the American Academy of Orthopedic Surgeons, AAOS, and the Arthroscopy Association of North America, ANA, as a component of the American Board of Orthopedic Surgery, ABOS, necessities for careful abilities preparing. The FAST module speeds up the learning cycle by offering ability-based able to use both hands preparing of arthroscopic abilities, similar to skyline control, picture focusing, triangulation, extending and utilizing an assortment of optics. This gives every one of the upsides of computer-generated reality recreation alongside the notable Sawbones Fast Arch. The combination of the Sawbones Fast Arch with the VirtaMed ArthroS computer-generated reality test system. VirtaMed ArthroS Knee. Numerous educational recordings, just as an assortment of society-embraced and expertly planned courses, would now be able to be gotten to via learners. The courses were created alongside the Arthroscopic Association of North America, ANA, and these were intended to close the hole that exists between the study hall and the working room. Directed analytic visits and triangulation practices assist students with further developing their instrument taking care of abilities and train them to recognize the significant tourist spots inside the knee. Remedial cases hence give learners the chance to test their recently obtained abilities on various knee pathologies, for example, arthrosis, free bodies, synovial layer swellings and meniscus sores. VirtaMed ArthroS, Realistic Arthroscopic Learning. Ideas of ACL recreation. This module was explicitly evolved to show ACL recreation, which assists students with diagnosing an ACL tear, eliminate the hindered tendon and distinguish the ideal destinations for joint substitution. Through this test system, understudies can learn in a danger-free climate how the joint capacity is influenced by even slight changes in the area of the substitution unite. A wide scope of accessible cases, crossing from inclined toward complete ACL tiers, permits students to acquire insight. The module likewise incorporates various instances of confusions that are looked during ACL reproduction strategies, and in this manner better plan students for the working room. VirtaMed ArthroS Shoulder. The shoulder module from VirtaMed upholds both sidelong decubitus and C-shore seat positions, and furthermore reasonable joint developments, like the working room. A 15-point shoulder test and resulting helpful cases permit students to rehearse shoulder root and work on their recently procured abilities on a wide range of shoulder pathologies. For example, pasta tears, free bodies, impingements, synovial layer aggravations and slap and Bankart sores. An assortment of society-embraced master-planned courses, incorporating courses created alongside the Arthroscopy Association of North America, ANAA, gives students a solid arthroscopic establishment. VirtaMed ArthroS Shoulder 2.0. VirtaMed ArthroS Hip. Through reproduction, learners can be shown everything the hip fundamentals in a danger-free climate and empower them to dominate these abilities before they go into the working room. Genuine careful devices, hip flexion and femur pivot, replaceable hip supplements, joint footing and the possibility to palpitate hard tourist spots give a total clinical encounter. The new without radiation fluoroscopy highlight of the VirtaMed ArthroS Hip assists instruct with adjusting passages without the additional expense of ordinary fluoroscopic imaging or undesirable radiation openness. After the learners secure the essential information on hip arthroscopy, helpful cases allow them an opportunity to test their recently gained abilities on different hip pathologies, like cam impingement, free bodies, sores in the ligament and labrum and synovial irritation. VirtaMed ArthroS Hip. VirtaMed ArthroS Ankle. Thinking about the intrinsic trouble of lower leg arthroscopy, reproduction fills in as a brilliant danger-free preparing apparatus. The ArthroS ankle module upholds back and prostrate situating of the patients, and gives the chance to notice the back and front parts of the left lower leg joint. Directed indicative visits and fundamental activities can be utilized to further develop the learner's instrument abilities and train them to distinguish the significant tourist spots inside the lower leg. Helpful cases furnish learners with the chance to test their recently obtained abilities on a wide scope of lower leg pathologies, like synovitis, ligament deserts, front impingement and free bodies. Stages. Ergonomic stage. The VirtaMed ArthroS ergonomic stage can be utilized with all VirtaMed muscular preparing modules, like fast, knee, shoulder, hip, and ankle. It is not difficult to mount every module on the stage and clients can change from one module to the next in under 30 seconds. Learners are furnished with unique devices and instruments, similar to a unique arthroscope, grasper, test, shaver and cutting punch. The instruments are incorporated with sensors and empower camera strategies, liquid taking care of, and hence permit learners to acclimate themselves with the ideas of 0, 30, and 70-degree optics. Anatomically right elastic models and unique instruments are incorporated to give a material vibe. The instruments and models, followed sub-millimeter accuracy, are obviously lined up with the computer-generated experience illustrations. VirtaMed ArthroS. Realistic arthroscopic learning. Programming planned explicitly for specialists. VirtaMed programming makes it simple to procure arthroscopic abilities. Skyline control pointers and cautioning messages train the appropriate use of instruments. Both inside and outside perspectives on the explanation empower students to arrange themselves as they learn joint root. Direction bolts assist students with learning critical anatomical tourist spots. Criticism reports with pictures and a video can be utilized to right away question students after each case. Such reports likewise recognize learning openings and screen the learning progress over the long haul.